GERD is short for disease known as gastroesophageal reflux disease, and this is caused by acid reflux. When there's food in the stomach, the acid is released, and when that acid goes back to the esophageal area, the lower sphincter of the esophagus is supposed to prevent from backing up, but when the lower esophageal sphincter fails, then the acid goes back up into the esophagus and even to the mouth, and the acid can cause damage to the cells by coming in contact. And this condition is what the GERD is. And depending on how bad the condition is, it could also cause what is called a Barrett's esophagus. And this is when all the cells that lining the esophagus is damaged, and then during the healing process, it is replaced by a columnar epithelial cells. These cells are more resistant to acid, but it could also be a cause for cancer. The cause for GERD could be hiatal hernia. It could be because of obesity. It could be because of a pregnancy caused by smoking or alcohol, and it could be caused by eating certain food that is very hard to digest, such as chocolates and fatty foods. The non-pharmacologic therapeutic approach, the goal is to reduce the acid from coming in contact with the esophageal tissue and prevent it from damaging it. So one of the approaches that we can do is diet control. Diet control, try to avoid spicy food, fatty food, acidic food, anything that may irritate the stomach with a higher acid content. So another approach is positioning of the patient. You don't want to have the patient lie down after they eat for several hours, so the gravity can do its job of keeping the acid content on the lower part of the stomach without letting it coming back up. You do not want to have the patient go to sleep within the 3 hours of eating either. So another approach is obesity, pregnancy, smoking, or alcoholism can contribute to the symptoms. So if you're obese, then you should have GERD, then you should go talk to your doctor, and doctor may refer you to a dietitian who can help you lose weight. If you're pregnant and have GERD, then doctors may create a treatment plan that will help you reduce the GERD symptoms while you're pregnant. Because smoking and alcohol can also depress the lower esophageal sphincter, the patient may be encouraged to quit. There's also another method, which is traditional Chinese medicine. Acupuncture had shown to improve the symptoms, specifically during the daytime. And the acupuncture studies been done that acupuncture may assist in the peristalsis for the food, so the acid or the food content will be going into the small intestine faster.
The usual dose for sodium bicarbonate is 325 milligrams to 2 grams 1 to 4 times a day in its tablet form. In its powder form, it's half a teaspoon every 2 hours, and in its effervescent powder form, it's 3.9 to 10 grams dissolved in water after meals. Its therapeutic action is the neutralization of gastric acid. Adverse effects include metabolic acidosis, edema, gastric distension, low calcium, sodium, and potassium. Drug-to-drug interactions include the lower absorption of ketoconazole and reduced effectiveness of methenamine. Food-drug interactions include avoiding a large amount of high-calcium foods and avoiding highly acidic foods while taking sodium bicarbonate. The usual dose for omeprazole is 20 milligrams once per day in its tablet form. The therapeutic action is a diminished accumulation of acid in the gastric lumen with lessened gastroesophageal reflex and the healing of duodenal ulcers. Adverse effects include abdominal pain, dizziness, fatigue, chest pain, hypomagnesemia, itching, and bone fracture. There are no food-drug interactions apart from a negative effect from taking it with alcohol, but the drug-to-drug interactions include a competition with any other agent that is also metabolized by the CYP450 enzyme system, a risk of bleeding that will increase if taken with warfarin, lower antiplatelet effects of clopidogrel, a rise of effects of antifungal agents, diazepam, digoxin, flurazepam, triazolam, cyclosporin, phenidine, saquinavir, triclosan, and warfarin, as mentioned earlier. There's a lower absorption of drugs that require an acidic pH. It lowers the effects of atazanavir and nalfenavir and rifampin levels. It raises the levels of cilostazol, triglycerides, methotrexate, and the risk of digoxin toxicity. And there's also reduced effectiveness if used with St. John's wort.
Prior to the administration of sodium bicarbonate, it should be cautiously used with patients with a history of heart failure and kidney problems, as it can cause metabolic alkalosis and sodium overload. It is important to establish baseline data to determine the effectiveness of the treatment and/or adverse effects, which include physical assessments and laboratory tests. Assessment of the abdomen for epigastric or abdominal pain and auscultation of bowel sounds should be completed to ensure gastrointestinal motility. Laboratory tests to compare initial values prior to administration and throughout treatment to monitor electrolyte levels such as serum sodium, potassium, calcium, bicarbonate concentrations, serum osmolarity, and acid-base balance. Renal function tests such as albumin to creatinine ratio and glomerular filtration rate should also be completed. Dose adjustments may be needed if values are abnormal, which may indicate adverse effects of sodium bicarbonate and problems with excretion. When administering sodium bicarbonate, it should be given 1 to 2 hours before or after other medications, especially those that are enteric-coated, such as most omeprazole preparations, as it can interfere with its delayed release and absorption. Also, patients need to chew sodium bicarbonate tablets completely and follow with water to ensure effectiveness of decreasing stomach acidity. Periodic monitoring of electrolyte levels, acid-base status, and general patient response to treatment should be completed to ensure effectiveness of treatment. In regards to omeprazole, it should not be administered if there are allergies to this or other related drugs such as benzimidazoles. It should not be administered to a breastfeeding parent, or breastfeeding should be discontinued. Also, epigastric or abdominal pain, as well as occult blood in stool, emesis, or gastric aspirate should be assessed. Omeprazole may cause hypomagnesemia, so obtaining a baseline of serum magnesium should be completed with labs and monitored periodically during treatment. Patients with a history of liver disease should be cautious, as AST, ALT, alkaline phosphatase, and bilirubin may increase, as well as serum gastrin concentrations. And the monitoring of CBC differential periodically is recommended. As noted previously, sodium bicarbonate treatment is common in the treatment of GERD, but it can have a negative effect on enteric-coated medications, such as most omeprazole preparations. Therefore, sodium bicarbonate and omeprazole should not be administered within 1 to 2 hours of each other. During treatment with omeprazole, the monitoring of bowel function is very important, as the patient is at risk of contracting Clostridium difficile infection. It is thought that there is a loss in gastric bactericidal barrier due to the decrease in acidity. Signs of diarrhea, abdominal cramping, fever, and bloody stools should be reported to the healthcare provider immediately. Also, as mentioned above, periodic monitoring of CBC with differential and liver function tests should be completed.
Upon discharge, the patient should be instructed on how to properly administer these medications. Sodium bicarbonate should be taken as directed, and missed doses should be taken as soon as remembered unless it is almost time for the next dose. When on sodium bicarbonate, milk products should be avoided as this can cause renal calculi to develop or hypercalcemia. Follow-up examination should be scheduled in order to monitor serum electrolyte levels, acid-base balance, and overall progress of treatment. If indigestion is accompanied by chest pain, difficulty breathing, diaphoresis, dark and tarry stools, then the patient should notify their healthcare provider immediately. Omeprazole capsules are taken before a meal, preferably in the morning. The medication should be taken for the full course of therapy, regardless of a change in symptoms. If a dose is missed, it should be taken as soon as possible, unless it is almost time for the next dose. The patient will be advised to avoid driving or other activities that require alertness, given that this medication may cause dizziness or drowsiness. The patient should avoid alcohol, products containing aspirin or NSAIDs, and foods that may cause an increase in GI irritation. Black tarry stools, diarrhea, abdominal pain, or a persistent headache should be reported to a healthcare professional immediately.